So, Eirik, you build a career in private practice, and actually you build a network of private practices in the Nordic countries called ORIS. So I know you since a while, and I would say that you're not only an excellent clinician that has focused a lot on immediacy, but you also like an excellent manager and leader, having developed such a large group of private practices, but which is not only providing care to the patients, but also providing educations to the field. So I'm very curious, Eirik, to learn a little bit how you navigated and collaborated with a company like Straumann.
Thank you. That was a very kind introduction. Thank you. I don't know if anybody or everybody agrees that I could be a good leader, but hopefully some of them. So, good afternoon, everybody. It's a pleasure to see you, and welcome to Mallorca. And thank you, France. Thank you, Andreas. Thank you, Straumann, for inviting me to this. And I think I've been giving quite a large topic. I would normally talk about the clinical part of me. Now I've been asked to talk about legacy to the future. And I think it's such a big topic to cover in the 25 minutes I'm going to keep you, but I hope to take you on a small journey along my history compared and combined with Straumann's history, and maybe make you a little bit knowledgeable about what we're going to face in the future. Because I think we have to see what we've done in the past to know what we're going to experience in the future. And hopefully this will make a context for you, because now you're going to have a lot of lectures today, tomorrow, and even Saturday, all the day. So I hope it will contain a little bit of framework. So this is what I represent. I represent what is called now a dental service organization. We run clinics in 3 countries. We have 116 clinics and 11 labs. We treat close to 1 million patients now a year. And we have more than 1,600 employees or co-workers or consultants. So to us, that's a system that needs to be also controllable. So what about the quality of care? How can we maintain all the employment satisfaction? How can we work to systemize things that is beside you being there? Because I have no option of being in all these clinics physically. So I'm going to talk about legacy. And I think if you define legacy, it's something that has been, but it's not given. And from Straumann perspective, and this speech is going to be most about Straumann actually, you're not giving away anything that's legacy. You're achieving it. So I think if you look at yourself, start working on your own legacy. So why is it important? Well, we have to know the past to understand the future. If you don't know about the errors, the mistakes, and the advantages we did in the past, you probably won't be able to do the right choices when it comes along. And I find knowledge as wine. I'm quite interested in wine. And the quality wine always gets better with vintages. I've also found that knowledge grows on yourself, and it improves by the years coming. So Straumann-wise, this year, they're 70 years of age. It's quite impressive, and I think we should look into some milestones of the company, because some of us have been with them for some time. So let's go the backward way. Let's go to 2017. Straumann in 2017 became known as the Straumann Group. The Straumann Group is how we know Straumann now. It used to be a one brand, one company philosophy. Now it's a house of brands. Now they represent different companies, both in biomaterials, in implantology, in ortho, and soon to be in many other fields. So it's important to realize how they developed this one. And again, I think if we go a little bit more back, we go to the 1990. This is when one of the founding family members of the company came in. He's called Thomas Straumann. And in 1993, he started reorganizing the ITI as a part of getting the ITI as an independent organization besides Straumann. A very important choice. I was lucky enough to be born the year before this implant was launched. So in 1974, the first hollow screw implant was launched by Straumann. And I was born then in 1973, so I passed the big 5-0. And this is the history. Some of you probably seen these implants in patients. I hope you've seen them, because it shows something about durability. But the company itself was founded by the engineer Reinhard Straumann back in 1954. So it all has a story, it all has a framework. And what's my story in this? Well, in 2001, I placed my first Straumann implant. It's close to 25 years ago. In 2005, I don't know why at that time, but I placed the first SLActive implant in Norway at that time. I just found a picture. I didn't actually remember it. I remember well that I placed the first BLX in human in the world, which is a thing that changed my career with Straumann. I'm also very happy that I get to meet Thomas at his hotel, which is in Basel. If you ever go there, please visit it. He has an own private terrace on the roof where you might go. And then together with a good colleague and a good doctor and a Straumann employee, we tried to recreate the famous ITI meeting in 1993 in Rheinfelden, where they actually made the whole foundation for the modern ITI. And if you compare that also with the rest of Straumann's history, I don't know if you're aware of it, but they used to work with alloys for watch industry. They used to work with the osteosynthesis business. They used to work with ski jumping, which is very close to the Norwegian heart of me. And they also used to work with speed measurements. They're engineers. This is the history of the company comes from this base. And if you look at the M&A history, the merger and acquisition history of Straumann, this is what they bought. I think I knew the company for 15 years. I remember when they bought Biora, the Emdogain inventor in Sweden in 2003, I think, 2004 or 3. And basically, nothing happened for a bit of a time. The last year, they grew. They have included technology, products, and solutions for patients in a faster way and a more successful way that I've ever seen in any other company in this industry. But there's always a but. When I started working with Straumann now, 23 years ago, the reason I started working is that there was a very major marketing word called simplicity. It was meant to be the reason to choose Straumann. You have this implant, these components, and then you go on. So simplicity makes sense to humans, because we like simplicity, at least the male population likes simplicity. I don't know about everybody else. We like simplicity. We like it straightforward. We like that we have a box. This is what you do. But then something happened, and during this transition, which is quite fascinating, from introducing the tissue-level implant in '86, fighting, if you were not part of it, fighting like, excuse my language, hell, for nearly 20 years or more, about if an implant should be tissue-level or bone-level. In those years, in the world of implantology, you were either green or you were red. I had a split suit. I was lecturing for the red side, I was lecturing for the green side. We talked about one-step protocol or a two-step protocol. Straumann was in favor of the one-step protocol. The red side was in favor of the two-step protocol. Straumann had the tissue-level implant, the red side had the bone implant, and it all mixed. And something happened. And I think in 2005, they launched the SLActive. 2007, they launched bone level. It's the biggest change that happened to Straumann ever. You suddenly cut away a neck of the implant and say, this is a Straumann product. 2009, they launched Rock Solid, and then it just continued. I think it was in 2015, they launched the apically tapered implant. Then they developed shorter implants, smaller implants, narrower implants, zygoma implants. It went all this way, even metal-free solutions. But the big change for me came in 2019, when they launched the fully tapered implant. To me, that was the biggest, by far, change Straumann has ever done. You moved from being very fixated on a long treatment protocol into my heart touching me on immediate protocols. But you needed an implant to do so. And by doing that, you introduced, all through this history, a lot of implants, a lot of components. You have now 3 different connections. So you have the Synocta connection, which is the only one. We have the CrossFit connection. You have the TorqueFit connection. And then we have all these different surgical cassettes. We have all the different prost things. What is this about simplicity? It's complexity. So we move from a story where we actually say adding complexity. And I think at a certain stage of a company, of growth, you will always add complexity. Because you're growing in the indications, you're growing in products, you're growing in your portfolio. But at some time, you always need also to rethink, look back, and say, do I need all this, or should I make a change for the future? So, but the thing is, like, most of you are clinicians or lab people, lab technicians. I would claim that we have these 3 people. We have the implant installer, AKA periodontist, surgeon, GP, or whatever, who's ever doing the surgery. On stages, you would typically call them surgeons. I like to call them implant installers. I'm an implant installer. And then you have also the tooth connector, which is also known as the prosthodontist, the restorative dentist, or a GP. Doesn't matter. And most of us, being the implant installers, we were happy about the development. The launch of BLX was a major improvement in our clinical work. Did it improve as much of the clinical work for the prosthodontist? Or let's talk about the tooth maker, the dental technician. They got more and more frustrated because we were adding complexity. We were adding connections. We were adding components. They need to be ready to anything. So who is most important to satisfy? Well, luckily for me and people in the implant installer profession, we are considered to be the golden childs. So keep the surgeons, periodontists, implant installers happy, then you're doing good. This has been the story of implantology. Is it correct anymore? No. Because it actually matters much more with the other people. So what did Straumann do then? In 2019, we started 2017, but it was launched in 2019. Now they launched a new implant, adding complexity. So they started the journey, in my opinion, to simplify by adding complexity. They built a whole new implant. They made a whole new connection. They made a whole new portfolio. And this slide is from one of the lectures I did in 2018 about the first 7 major breakthroughs that I saw when Straumann launched the BLX. So it was the availability. We had implants from 3.5 to, in the end, 6.5, from 6 millimeter, now 4 millimeter, to 18 millimeter, and probably also expand. We could solve any case. We also had the stability, meaning that we had the fully tapered implant, so at any type of indication, we could actually make it. Then Straumann did something. They refined all the small instruments. And I know it's not a big thing, but if you're a clinician, and if you work with this daily, like I basically am doing, I'm not doing clinical anymore all the days, but I used to do until recently, it actually matters. It matters with the small, tangible instruments that we work with every day. And then they made what they call the constant emergence profile concept, which I call the GH concept, is making healing abutments work smart. So healing abutments doesn't care just how deep you're in soft tissue, but how deep you are in bone. So we're able to place implants more, on the infra level of bone instead of keeping them bone level. And also the SRA design was a big thing. And if you look at now the SRA design from Straumann compared to the competitors, you will see now launch from the competitors resembling Straumann. So Straumann became the company that was leading also the prosthetic part. That hadn't happened before. Because we were constantly seeking other alternatives because they were better. It changed. To me, it changed radically. And then we had the 6 millimeter implant. That changed much because you were able to make a connection that made me able to place 6 millimeters implants, while my original system, because I was in love with the red side for many years, the smallest implants I had was 8.5, the shortest one. Suddenly I had another indication. And in the end, it was the connection, the torque-fit connection. That's basically the most important advantage of everything they did. They made a connection that finally solved the amount of positions, not creating a chaos in the inventory of both the clinic and the lab. So again, how is always about every strategy you do now. When you go back home to a clinic, will always be why, what, how. If you did a workshop on strategies, you will have a consultant that you pay a lot of money. They will go, why do you do it? What do you do? How do you do it? So on Straumann-wise, it's the same. So, did it change anything? Did it actually change anything from Straumann's perspective, this? No. They added a hell of a lot of new implants. But what they did is they made it as one connection. And this is a take-home that I can't say too often because I get called up every week from restoring dentists or dental technicians. I have this type of implants, do I need another component? It's the same connection. You've got one prosthetic platform with all the availability. And now you have the availability in both this BLX and TLX and the BLC and TLC, which is a revision of the original BLT. So I think all this adds up because now we're simplifying. We have one connection, one workflow, one everything. I got one surgical cassette. My nurses in my surgical team, I worked with them for 20 plus years, as you know now. They have an average age, the average, of now 73.2. 73.2, that's the average of these 4 girls that I work with. They know implant history since Brånemark was there. Do you think they love having one cassette, one system, one portfolio? Yes, for sure. So you can streamline, you can make simplifying of the inventory, you can control more of what you're working with by having one connection. And this is where Straumann will add components and innovations. So you will have the metal-free solution, which I know is important for some of you, and a 2-piece. We will have 4 millimeter, which is now on the market, 4 millimeters implants and TLX. There will be a new guided system for this, called the iGuide. You will see this at the booths. It's going to be launched, I think, next year. But you will have a look at it around. And not least, you will also have an increase in the prosthetic portfolio. So any of you working with the Vario base, which is my bread and butter abutment, you know that sometimes the height of the chimney might be a little too, okay, now you have a longer one. They listen, they develop. Okay, might be a little bit too smooth the surface, so we roughen it. Yeah, we need better angulated solutions. Well, they listen and they work upon and then develop. And this is where I find the company so extremely satisfying to work with because they listen. And they want to make us better because we are doing solutions that makes purpose out of patients' lives. And then you have the digital part where I would say, just mention, you probably see in the Revex scannable part that goes if you the other way of scanning. Then you have the Tektron system. If you haven't seen it, you will also see it outside, scanning full arches, which is very interesting. And then you have the new thing with scannable anatomic healing abutments. Some of you already tried. It's also to be launched next year. And then there's also this digital workflow that comes in for Novalock. So everything's moving in this direction with this connection with the what is called then the IXL system. So it makes sense. So legacy is well taken care of, but the company, as I see it, is moving towards what I will define the future. So let me return to the why again. Why do we spend time talking about the past? Well, we have to know the past to have an opinion on the future. Use that in your general life. Everything goes, the history tells us a lot of what we need to do because we're creating better solutions. Why do we do it? Well, we do it due to the patients. And I know that from this stage, when I'm invited, I always define them as customers, because I think they're entitled to customer service. If you're a patient, if you're a customer. I know professionally we are treating patients, but we should aim at giving them customer service. Because if you give them customer service, you would be aware of something. All these patients, I don't know, I know that you are from like 50 countries around the world. Some of you struggled for months to get a visa to come here. We all have the same patients. They have one currency in common. One thing you can't buy, you can't get it back, you can't apply for more, you can't change it in anything, and it doesn't differ from wherever you are in the world, and that is time. That's the current common currency we have. And our solutions, they need to focus on our patients, our customers. What's most important for them? Time. That's how we develop solutions. So if we look into the future as the last part of this, we know that a business, your clinic, your clinics, your labs, they either grow or they slowly die. You go to any business conference, you will hear this sentence. You either grow or you slowly die. Why do I say slowly die if you don't grow? Because the rest of the market, your competitors, the prices, the penetration of these treatments, they will grow around you. You have to be part of the growth, otherwise your curve is going to go downwards. And that's how we plan for the future. So I think it's important that your task is to keep up the growth for your clinic. How do we do that? How do we maintain the possibility of growing for our clinics? Well, you need to scale. What does scale mean? I mean, you're one person. If you run a large and successful clinic, it's all down to you. You don't have much more time than I have or anybody else. You can only be in certain places at one time, and you can't transfer yourself. So you have to make scalable systems. And you have to put it into context. You actually have to take some time away from your patients, put yourself in the planning chair and say, I would like to plan now how I'm going to scale my clinic for the next 10 years. How will I pass on my knowledge? How will I pass on systems? How will I maintain quality? And how will I maintain the best ever patient care that we do? Without me being at work every day, telling everybody what to do. How do you put that system? So how to scale? I have 8 pillars that, in my opinion, very personal, not scientific, but experience-wise, the ones that I put into position. So I put in mindset, knowledge, science, system, patience, efficiency, skills, and what most of us need the most, humbleness. It goes to mindset. It all starts with the clinician. And knowledge is what we do today. We look back and we realize something happened before we came into the picture. And with science, I don't know, how many of you are old enough, it's just a small raise of hands, to watch the X-Files? Some of you, right? Do you remember the statement when, I think it was Scully that said to Mulder? She said, the truth is out there. Remember the last part of the sentence? And so are the lies. The truth is out there, and so are the lies. And then it comes into system. I'll return to that one. Patients, we need to start talking to patients about solutions. Do not mix English and Latin and expect the patients to understand. Talk about their feelings. Talk about solutions that will make sense. And efficiency is putting things into a system that can work when you're not at work. Skills, if you want to go for immediate solutions, and you've been a traditional doing implantology, you have to train again. I'm sorry. It's a totally different skill set. And humbleness, I know it's a very difficult thing. My wife tells me, at least, that I have issues with humbleness. She's a psychologist, so it helps. But be a learner, because all your failures will teach you something. And if you haven't had a failure, if you haven't broken an implant, you just haven't done enough. They will come. So system and efficiency is what this legacy and this company might be a part of, because if you look upon the advantage of having one set of all the things I talked about, so that you can go into any surgery every day, you got this one cassette, I'm going to do this, and by the end of the surgery, if you want to, you can choose the implant. That's something. And I've been doing this for close to 25 years now, and I've never seen anything like this. So remember now, whatever you do, whatever you change as part of the legacy, we're never going to reinvent stuff. It's been done. But we're going to slowly change and improve all the stuff that we're doing. So by that, I would like to extend you all my best wishes for the rest of the weekend. And enjoy. I think it's going to be 3 fun days. We're going to have socializing and professional fun. And hopefully, we will have some knowledge to bring back. So thank you so much for your attention. I'll see